We are covering the Joint Commission's National Patient Safety Goals, a critical topic you must master for the phlebotomy exam. These goals are not just best practices. They are the foundation of exam questions that test your ability to ensure patient safety. Let's start with the most tested concept, using at least 2 patient identifiers. The exam will present scenarios to trick you. For example, you approach a patient's bedside, and the name on the door matches your requisition. You ask, "Are you John Smith?" and the patient nods. This is a classic trap. You must have the patient actively state their full name and date of birth. Then, you must compare that information against their wristband and the requisition form. A common wrong answer choice on the exam is using the patient's room number as an identifier. This is never acceptable. Remember this phrase, 2 to go before the flow. It's a simple mental shortcut to ensure you always confirm at least 2 unique identifiers before the blood begins to flow. Another key goal is improving communication among caregivers, which for a phlebotomist often means handling critical results. An exam question might describe a scenario where you draw a sample and the lab reports a critically high potassium level. The question will test your knowledge of the proper protocol, which is to ensure the result is reported directly and in a timely manner to the licensed caregiver, such as the patient's nurse or physician, who can act on it. You will need to know that a readback of the results is typically required to confirm correct communication. Next is the goal to reduce healthcare-associated infections, or HAIs. For phlebotomy, this is all about hand hygiene. The exam won't ask if you should wash your hands. It will test the specifics. For instance, you must perform hand hygiene before and after every single patient contact. If your hands are visibly soiled, you must use soap and water. Alcohol-based sanitizer is not sufficient. Be prepared for questions about wearing gloves. Gloves are not a substitute for hand hygiene. You must clean your hands before putting on gloves and after removing them. The universal protocol is another safety goal, primarily known for preventing wrong site surgery. For a phlebotomist, the principle applies as a pre-procedure verification. This involves confirming you have the correct patient, the correct orders, and the correct equipment at the bedside before you even apply the tourniquet, reinforcing the importance of patient identification. Finally, let's discuss sentinel events. A sentinel event is an unexpected occurrence that results in death or serious physical or psychological injury. For a phlebotomist, a critical example would be a patient suffering a severe transfusion reaction because a pre-transfusion specimen was mislabeled. Exam questions will focus on your role, which is prevention through strict adherence to identification protocols and immediate reporting if an error occurs. Following a sentinel event, the facility must conduct a root cause analysis to figure out why the error happened and to prevent it from happening again. Understanding these Joint Commission safety goals is non-negotiable for passing your phlebotomy exam, as they directly translate into questions about the safest and most effective way to perform your duties. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word.com.